Hi, Barbara Wally here, orthopedic and sports certified physical therapist, here for our final video, the fourth video of 4-part series speaking about low back pain. So today we're going to talk about how to keep your back healthy. Say you've dealt with issues in the past with low back pain, or you really don't have any back issues and you want to learn how to keep your back healthy. Well, you're in luck, because today we're going to talk about methods to keep your back healthy. But first, let's review our last video. Our last video spoke about physical therapy interventions and what can be done for you if you do select physical therapy to treat your low back pain. So just remember, it's less impactful than, say, methods like surgery. It's cheaper than the other alternatives, including injections and surgery. And it's tailored to you. So it's an individualized approach to help you reach your goals and what you want out of life and out of physical therapy. It is highly skilled care. The standard today is for physical therapy to graduate with a doctor of physical therapy, and those who don't have doctorates aren't any less. It's just they've got a lot of years under their belt by today's standards. And if you haven't had a good experience, try again. So if there's one place you went and you didn't like it, don't throw the baby out with the bathwater. Try again. Try a new location or a new physical therapist at a location closer to you. And have appropriate expectations. Know that physical therapy is not a cure-all. So just make sure whatever you do with physical therapy, that you have reasonable expectations and you talk about those expectations with a physical therapist. But let's move on to how to keep your low back healthy. So probably one of the biggest ones is posture. So talking about posture, how we sit, making sure when we sit for long periods of time that we have good posture and we put ourselves in optimized position. So making sure you have an appropriate chair at work if you sit for work, making sure your chair at home when you watch TV is comfortable and good for your posture and your positioning. You can even use a lumbar roll or some pillows behind your back just to elevate you. Or even thinking about things like shoe inserts. Maybe you have a lot of pain when you stand and walk with your back. Maybe you need to consider different shoes or get some inserts for your shoes, or maybe just get a new pair of shoes. And simple things like body awareness, understanding how you sit, how you stand, simple things like leaning all the time on one of your armrests. You might have the best chair in the world, but if you do this every time you sit in the chair, that's something that you might need to modify. But think about proper lifting techniques when you have children at home, or you have a job where you lift and carry a lot every day. You need to think about how you lift and carry, bracing your core, lifting from your legs so that you're not stooping forward and lifting from your low back. Limiting how much weight you lift. If you remember from our past video, about 50 pounds is the max for men and about 35 pounds is the max for women when it comes to repetitive lifting without assistance or without mechanical assistance. So trying to limit how much weight you are moving on a day-to-day basis. Stay healthy. So we all know this. You got to stay healthy. So make sure you're stretching, make sure you're doing some maintenance exercises and strengthening if you are a very active individual, and making sure you're eating well. So a well-balanced diet with, low fat, and still eating your carbohydrates and your fruits and vegetables, using food as medicine, and even supplementation, simple things like, supplements with curamine capsules or ashwagandha or ginger. And remember, I'm not a nutritionist, just some little recommendations here and there, but being able to use supplementation to your advantage to help decrease inflammation and issues you're having with pain. But maintaining a really healthy lifestyle is so important. Making sure that you're not overdoing things and lifting too much or doing too many activities or overtraining if you're training for, say, a competition, but also not being too sedentary on a day-to-day basis. If you sit too much and don't exercise enough, when you go to lift something heavy, say a suitcase when you go on vacation, it's going to set you up for a potential injury. And making sure you listen to your body. If you do like to exercise or you're doing a lot and there's a certain thing you do that hurts, you need to listen up. Your body's trying to tell you something. But making sure you maintain a healthy weight is important. Weight distribution can make or break you. If you tend to carry a lot of weight around your midsection, that's going to create a lot of strain on your back, or even a lot of weight around your hips can create a lot of strain on your back. Stress is another one. Stress is a huge thing. It can affect our entire body systems, but keeping stress levels down, learning how to manage and cope with stress is huge, because stress can cause a lot of inflammation in the body and can really exacerbate or worsen our experience of pain. And then when you're in trouble, make sure you reach out and utilize your resources like your doctor, your physical therapist, and be proactive and have healthy expectations for your body. We do age, and as we age, we do run the risk of wearing out our parts. So just making sure as you get older, you're adjusting your activities and your expectations for your body and making sure you don't do too much or overstrain your system. But just to review, we did a 4-part series on low back pain. The first talked about the why of low back pain. The second talked about what can be done for low back pain. The third talked about physical therapy and low back pain. And our video today was about how to stay healthy with low back pain. But I hope this has helped and you've learned a lot. And if you want to check out my videos, I've got a lot of videos about a lot of different things with the human body and physical therapy. Just check out my videos. My name is Barb Wally, physical therapist, orthopedic and sports specialist. Thank you so much and have a great day.